Hi, welcome back. We're on chapter 1, and we are in the third video for this series. And for this video, we're going to go through slides 21 through 37. We're going to be talking about anatomical terminology. This is probably the most important part of this entire chapter. Please spend time learning the vocabulary words in this section of this chapter. They are going to be the most important thing for you to know for the rest of your anatomy and physiology career. Okay, so it's going to be a long list of vocabulary words. We're going to spend a lot of time with this in lab. Hopefully you've already done that by the time you watch this video. But these are important words that you will want to know through the rest of biology 231, 232, and 233. If you are a radiologist planning to go into radiology, this is so important to you. I want you to really pay attention to this. If you're going into any other medical career, this is important to you, okay? So let's go ahead and pull up those slides. We're going to go over here. Whoops, just a second. Sorry. Let me call that up. Go back over here. Call those slides up. Okay. Go to our first anatomical position. Here we go. All right. So anatomical terminology. So this just sets you up for learning about when you're talking about a body part, where is it? Okay, so we really have to understand how this works. So first of all, we need to know what is the anatomical position when we are talking about different body parts. When you are working with a model, when you're working with a person, when you're looking at a slide even, you need to know what is the anatomical position. So the anatomical position, when we say that word, what we're talking about is how is the body set. So anatomical position is hands at the sides, palms are forward. And when we say supine, we're saying lying down, face up. Prone is lying down, face down. So every time you're thinking about, is this on the left or the right side of this body? Is this on the front side or the back side of this body? You need to understand that we're talking about a body with palms facing forward and laying down. Okay, so that's how, whenever somebody is trying to explain position to you, front or back or up or down or whatever, we're always imagining a body laying on a table, palms forward, palms up, and face up. We're usually talking about it supine. If the body has been turned over, the palms will be down with the body, and this will be a prone position. Then when we start to talk about different body parts and where they're located, we need to learn basic anatomical landmarks. These are going to be the things you learned when you were 2 or 3, most of them, right? Where's your elbow? Where's your tummy? Where's your knee? Okay, so those are anatomical landmarks, and they belong in anatomical regions that are determined by those landmarks. So we're going to have, for instance, the abdominal region is going to be where your abdomen is. Okay, that makes sense. So we're going to learn those different things. Then we're going to talk about the abdominal pelvic quadrants and regions. So the abdominal pelvic quadrants are when we're talking about the abdomen. The abdomen is a large part of your body, and so we've made it into quadrants. What organs are parts of those different regions? We're also going to be learning about anatomical directions: front, back, left, right, higher, lower, those different kinds of words. These are all going to be really important for words for you to understand and be able to describe anatomical place, right? So where is that organ? We're going to use science words to help us determine where those organs are. So we're going to start out with anatomical landmarks. So many of these you already know. You may not know the sciencey word. I'm not going to go through all of them because you're going to be working with these in lab. So these are the words you need to know. Please learn them. Please get comfortable with them because you will use them throughout all of your anatomy and physiology classes, and you'll learn them you'll be using them in your job. So for instance, when we are talking about the cephalon, what we're talking about is the head. Now that one you might not have known before. So the cephalon or cephalic region is your head region, and it includes your skull or your cranium and your face or facies. So these are words that you already know. So that's good. So if I say, well, where is your cranium? You probably already know it's up here, right? That is part of the cephalon region. Okay, nose is also nasus, nasal. those are words. Oculus is also the eye. So oculus is eye. Oris is ear, or also called otic. Cheek is bucca or cheek. Cervical, you guys, cervical, we're going to use that one through 231, 232, and 233. Really get to know that one. So usually if you say cervix, the cervical area, you think cervix, and then you think maybe part of a woman's reproductive anatomy. Not true. Not for us. So when we say cervical, what we're talking about is the neck region. So that's going to be one that kind of throws you. So please make sure that you look through these words and start to know them. We have them for many different regions, the upper, the lower, the front, the back. You will spend time to learn all of these different structures and regions, and here they're set up on the table really easy for you. So again, you're studying these in lab. That's why I'm going through them really, really quick here. The structures are on the left, the region is on the right. So cervicus is in the cervical region. So your neck is part of the cervical region. The brachium is part of the brachial region. This one is your upper arm. The antebrachium is your forearm, the lower part of your arm, and that's in your antebrachial region. So if you could start to learn these words, carpus is your wrist, that's part of the carpal region. If you can start learning some of these words, man, when we get into the muscles and when we get into the bones, easy peasy lemon squeezy, you are going to learn these things really fast. This is also going to be really helpful when you learn blood vessels in 232. When you learn all the different blood vessels, the blood vessels are named after the region that they're in. So you have a brachial artery and you have a brachial vein. So we're going to learn a lot if you memorize these words. So you have two tables. These are the words that you want to focus on for quizzes and exams. These are all the different regions and different structures of the body that you want to learn right up front at the very beginning of this class. Then we're also going to ask you to start learning about the abdominal quadrants. So there are 4 quadrants. That's what quad means. So there's 4 abdominal quadrants. We have the right upper quadrant and the left upper quadrant. We have the right lower quadrant and the left lower quadrant. Upper lowers, really simple. Here's where you start to pay attention to right and left. If you look at this body, it's his left, not our left. If we look at this picture, the word left is on the right side of our screen, okay? But it's his left. What we're talking about is what belongs to the anatomical body that we're looking at. So his left side is going to be on the opposite side of the picture that we look at. When you look at someone's body, it's going to be on your right side. His left side is going to be on your right side. So this is really hard at first to think about. Maybe you think it's simple, but it's really hard, especially when we start to look at the heart, right? Or when we look at a bone or a muscle. You want to make sure that you understand that left is his left and right is his left in this picture. So what are the organs that are in these different quadrants? Then we're going to look at this. So we do quadrants, and then we break those quadrants into different regions. So the regions on the right, on his right, are hypochondriac, lumbar, and inguinal. So hypochondriac is going to be below his chest. Lumbar is going to be at the lumbar section of his vertebra, so that's his lower back. And then inguinal is going to be more in the crease between his torso and his leg. In the center, we have, and so on the right side, we've got those, and on the left side, they match. So we have the rights and the left. And then in the center regions, we have the epigastric region, umbilical region, which is right on his belly button, and the hypogastric region, which is really the pubic region. If we go back over here and look at the quadrants, the center where all the quadrants come together is the belly button. The top here is right at his diaphragm, which is right below his lungs. Okay, so it's right at, it's going to be where his diaphragm goes up. And then the bottom is going to be where his torso ends. So we have quadrants, which is 4. Then we have regions, which are 9. If we look at the organs that belong to different regions, if we look at the quadrants, there's quite a lot. The liver is going to be primarily in the right, the right upper quadrant, and the stomach is primarily in the left upper quadrant. The spleen is in that left upper quadrant as well, but it's all the way over there in the left hypochondriac region. The reason why we use these different terms is because somebody's going to come in and they have pain in their abdomen. Well, that's a really big area, and there's a lot of organs in there. So we want to try and narrow it down by determining which quadrant it's in, and if we can, trying to determine which region it's in, because different organs will be in different regions and different quadrants. So if someone comes in and they have a lot of pain and it is in their right upper quadrant, we can say, well, it could be the liver or the gallbladder, right? It's definitely not going to be the appendix. But if somebody comes in and they have pain in their lower right quadrant, where the appendix is, then we could say that maybe there's a problem with the appendix. So it helps us to narrow down which organ it's in if we can determine which part of the abdomen is hurting. Okay, now the last major thing that we want to talk about in this video is anatomical terminology related to position. So in this one, we're going to use a lot. You're going to use this with every patient that you have too. So you want to start to learn some different words. So first of all, front versus back. When we are talking about the front of someone's body, we're talking about the anterior surface versus the posterior surface. Now, if you're a vet and you're going to go into vet tech or you're going to go into veterinary studies, you will more likely call the front the ventral and the back the dorsal. Okay. The reason there's a difference here is anterior for a human being, we stand on 2 legs and we stand upright. So we have a full front and we have a full back, anterior, posterior. And animals that are standing on 4 legs, they will have a ventral and a dorsal. So the ventral for them would be the tummy section that's facing the ground, and the dorsal would be their back. We will use different structures and name them based on ventral and dorsal, but primarily we use anterior and posterior. Okay, so the anterior is going to be what is on the front of your body. The posterior is going to be what will be on the back of your body. Superior versus inferior. Superior is towards the head, inferior is towards your feet. So we would say here that the shoulder is superior to the ankles, for instance. Or we would say the ankles are inferior to the knee. Okay, so these are directional terms. And then the last thing that's in this picture is proximal versus distal. Proximal versus distal are usually only used when we're talking about the limbs, so the arms and the legs. Distal means towards the toes or towards the fingers, and proximal means towards the core of the body, so more towards the core. So in this case, we could also say that the ankles are distal compared to the knees, or that the knees are proximal to the ankles. Okay, so these are directional terms. And again, you're just going to study these in lab. So here's another picture. We've got superior and inferior. Okay, so that's the entire body. We also have proximal versus distal for the limbs specifically. And then another word that we have, oh, and then we've got right and left, which we've talked about already, right? It's the body's right or left. And then the last thing that's on this picture is lateral versus medial. So lateral means away from the center of the body, and medial means towards the center of the body. So the heart is medial compared to the lungs. The lungs are lateral compared to the heart. So these are directional or relational terms. The shoulders are lateral to the rib cage. Or we say that the rib cage is medial compared to the shoulders. So lateral means on the outside of the core, medial means towards the inside of the core. So lateral medial is going to be for the core of the body, proximal and distal is going to be for the limbs. Here are the words on a table format for you to learn. So we have anterior, ventral, posterior, dorsal. Cranial is going to be towards the head. Superior is going to be above. Caudal means towards the tail, so towards your buttocks. Inferior is going to be the lower part of the body. Then we have medial and lateral, proximal and distal. And then the last one I'm going to mention here is superficial and deep. Superficial means that it's on the surface of the skin, the surface of the body, compared to whatever we're looking at, which is deep inside the body. So the skin is superficial to the heart. Or if we're looking at different layers of something, the skin is superficial to the muscle that lies beneath it, or we say that the muscle is deep compared to the skin. Okay, then anatomical terminology, we're going to continue, I guess, with sectional anatomy, which is something that radiologists are going to do, people who use x-rays, CAT scans, PET scans. All of these are going to be using sectional anatomy. So what we're going to do is we're going to look at a plane. We're going to cut the body visually. We're going to, with a tool, right, with an x-ray or whatever, we're going to have to decide if we're going to cut it frontwise to backwise, leftwise to rightwise, or right through the middle. So that's a plane. And then we can take sections once we have the plane cut with our CAT scan or whatever, our MRI. Once we determine which way that we want to look at things, then we can take slices and look at sections which are parallel to that plane. So radiological techniques, MRI, PET scan, CAT scan, those are going to use this terminology really important. We need to know how to look for the body part and how it is in relationship to in space. So in this picture, we're going to show the frontal plane. So the frontal plane is when you cut the front from the back. So we're going to go with this line and cut the front from the back. So we're going to go the long way of the body, cutting it from top to bottom, separating the front from the back. So that's that plane, the frontal plane. The sagittal plane is going to go through the middle of the body, separating left from right. So we have the frontal plane, we have the sagittal plane, which creates left and right sides. And then we also have the transverse plane. The transverse plane is a cross section. So it's this one right here. If I want to look at a specific organ, then I need to know which direction I need to go best to look at something best. If I want to look at the organ from the front and the back, if I want to go from side to side, I need to know that and set up my equipment so that I do it in the right plane. Okay, so we have 3 planes: frontal, sagittal, and transverse. Transverse is that cross section, cutting it the short distance and right through the middle of the body, separating top from bottom. Sagittal is cutting left from right. If we are exactly in the middle of the body or organ, we're going mid-sagittal. If we're going to go a little to the left or a little to the right, that's parasagittal. And then we can also do the frontal or coronal plane, and that's going to be separating the front from the back. And you'll see this a lot when you look at x-rays or when you look at MRIs or PET scans. All right, so that's where we're going to stop on this video. This video sets you up with a lot of vocabulary, learning a lot of different words. Now, a really good way to learn this is by going through making note cards. I would strongly recommend you do note cards, especially for 231. 232 and 233, you might be able to get away with not using them, but man, you're going to want them for 231. You are going to be thrown a lot of new words. A lot of those words are related, though, to things that you already have in your brain. This is really good. You know a lot. You're just going to be tweaking the words that are associated with those things. So you are going, like you already know what the neck is. If I say, where's the neck? You know it's right here. Let's add a new word to it, which is cervical, the cervical area. And it's okay. So we're adding to what you already have in your brain. No cards, no cards, no cards, no cards. The best way to make a note card is to put the word on the front. That's it. And then turn it over, draw a picture, and maybe 3 or 4 words that describe what the word is on the front side. Do not write a paragraph. Do not write 10 words. Okay. The best way for a note card is pictures, visual clues, and just a few words. You want to be able to stop at a stop sign, not a stop sign, a stoplight. You want to be able to stop at a stoplight and go through about 8 cards. Okay. And you can't do that if you have a whole bunch of writing on there. Do not fill up the note cards. The note cards are supposed to be fast. You're supposed to be able to look at them, identify it, boom, and be done. So strong recommendation, note cards for this section. All right, I will see you in the last video of this series, of this chapter, chapter 1, in the next video. All right, bye.